Hey, all, welcome back to the Real Life Pharmacology Podcast. I am your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. We've got a free top 200 study guide. It's 31-page PDF, a lot of content within there. And of course, a lot of important things you're going to see throughout your career as a practicing healthcare professional, as well as throughout school in pharmacology courses and final exams, board exams. So definitely go take advantage of that free resource at reallifepharmacology.com. With that, let's get into the drug of the day today, and that is Vardenafil. You might notice that ending, Vardenafil, similar to sildenafil. Tadalafil is another example. So this is a PDE5 inhibitor that is used for erectile dysfunction primarily. Levitra is the brand name here. Mechanistically, how does this medication work? So with the process of male sexual stimulation, nitric oxide plays an important role. And this nitric oxide release activates guanylate cyclase to increase cyclic GMP. So cyclic GMP is an important mediator in helping to create the male erection. So what Vardenafil does is preserves cyclic GMP by inhibiting phosphodiesterase 5. Okay, so this is basically an enzyme that breaks down cyclic GMP. So by blocking PDE5, we're increasing the amount of cyclic GMP, which helps with erection and things of that nature. So that's how the drug primarily works and helps with erectile dysfunction. Dosing ranges typically for most patients somewhere between 5 and 20 milligrams, given before sexual activity, usually approximately 60 minutes at least. Off-label, there are some uses for Vardenafil and PDE5 inhibitors in general, I guess. Pulmonary arterial hypertension and Raynaud's are probably the two most common. With that said, I don't think I've ever seen Vardenafil used for that purpose. I have typically seen sildenafil, that would be Viagra or Revatio, and then tadalafil, or the brand name there is Cialis. So I see those two, or have seen those two, much more frequently in some of those off-label uses than I have Vardenafil. So just a little clinical practice experience, at least from my perspective there. All right, adverse drug reactions. So the two most common things that patients are going to report are flushing, so kind of that redness in the face, warm sensation type feeling, and headache. So those are the two biggest things. Probably third, it can drop blood pressure. So we've really got to pay attention, particularly maybe in patients that are at fall risk, or maybe they have already lower blood pressure to begin with. It may really exacerbate that issue for them. So generally, low blood pressure, dizziness in younger, relatively healthy patients, probably not too big a deal, but as we go up the age spectrum, we may run into that risk a little bit more there. Now, rare adverse effects, there are some rare things that have been reported, certainly. So one is visual color changes, visual changes. Hearing issues have been reported rarely. And then priapism, so basically this erection lasting an inappropriate length of time, several hours, for example. Contraindications, so nitrates, I'll talk about that a little bit more with drug interactions. I do want to point out that the recommended separation for Vardenafil is 24 hours. Now, this is the same as sildenafil. If you remember, tadalafil actually has a longer half-life. So that recommended separation is at least 48 hours there with nitrates. So don't take them together, and those are the recommended time separation between when you might be able to, or should be able to take a nitrate compared with a PDE5 inhibitor. If you want a little bit more reading on that, I've got an article, recommended separation for nitrates and PDE5 inhibitors, and that's at meded101.com. So if you just Google search that, recommended separation for nitrates and PDE5 inhibitors, you should get it in your search engine there. Kinetics. So the onset of action is 60 minutes. So when the package insert says it's recommended to give at least 60 minutes before sexual activity, that's why, because the onset does take a little bit of time. For maybe you dietitian folks listening, or if you want just another clinical practice pearl for patient education, if you've got a patient that's reporting it's not working that well, keep in mind that a high-fat meal can actually lower concentrations. So definitely one little caveat there. If a patient is eating with it or around it and they have a meal that's higher in fat content, it may actually lower drug concentrations. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material, like ambulatory care, pharmacotherapy, geriatrics, NAPLEX, or other exams, go check out meded101.com/store, S-T-O-R-E. In addition, we've got new resources out for pharmacology folks. If you're in school, just out of school, taking board exams, check out Flippin' Pharmacology flashcards on Amazon, as well as Pharmacology Crossword Puzzle Activity Book by MedEd 101. So 2 great new resources, been really helpful, pretty highly rated now. Definitely going to help you prepare for pharmacology exams and just get better at pharmacology in general. So go check out those resources. Support the sponsor, meded101.com/store, S-T-O-R-E. All right, drug interactions. So I already chatted about the major drug interaction, and this is going to come up on board exams, pharmacology exams, and that's with nitrates. So, nitroglycerin, isosorbide mononitrate, isosorbide dinitrate, those type of medications. We've got to avoid PDE5 inhibitors. And basically what happens is it's a substantial reduction in blood pressure that can lead to syncope and some really bad things. So definitely pay attention to that. Obviously a well-known board exam question that you're likely to see there. Some other things to pay attention to. So alcohol intake can potentially have an exacerbating effect on dropping blood pressure. It can also worsen flushing. Alcohol alone, particularly in excess, can definitely cause some flushing. Adding it on top of a PDE5 inhibitor like Vardenafil can increase that risk for flushing. Other blood pressure lowering medications, I think that's a lot of common sense. ACE inhibitors, beta blockers, alpha blockers are probably one of the worst. They can really have an exacerbating effect on hypotension. CYP3A4 inhibitors. So Vardenafil is broken down by CYP3A4. So if we use a CYP3A4 inhibitor, classic dietary example is grapefruit juice, we're going to increase the concentrations of Vardenafil and obviously, increase the risk of flushing and headache and dizziness and all the adverse effects that go with it. So definitely something to pay attention to. And of course, there's many, many other drugs that can inhibit CYP3A4. And then it is reported in the literature. I wouldn't say I worry about it to a crazy extent, but QT prolongation risk has been reported with Vardenafil. Obviously, this is going to be in patients on drugs that interact with that. So, amiodarone, quinolone antibiotics, antipsychotics are a few examples that just kind of would increase that risk for QTc prolongation. All right, well, I think that's going to wrap up the podcast for today. Thank you so much for listening. If you enjoyed this episode or found it helpful, please leave a rating, review on iTunes or wherever you're listening. Greatly appreciate that. Also share us, friends, colleagues, classmates. Don't hesitate to share the podcast as a resource for those taking pharmacology courses and board exams and things of that nature. So please do that. If you want to reach out to me, suggestions, comments, don't like something, do like something, no worries at all. I've got quite a few of compliments and complaints, so definitely open to hearing them. mededucation101@gmail.com is my email, or LinkedIn is probably the social media platform I'm most active on. You can find me there, Eric Christensen, PharmD, BCPS, BCGP. Don't forget to support the sponsor, meded101.com/store. Those two great resources, fairly brand new out, Flippin' Pharmacology flashcards and the Pharmacology Crossword Puzzle Book by Meded101. Go take advantage of that. And if you're in the market for pharmacist board certification study materials, we've got a great list of resources there as well. So again, all those links can be found at meded101.com/store. Thanks so much for listening, and I hope you have a great rest of your day.